We've got to go farther. We've got to make sure that more and more people get vaccinated. We've got to make sure our schools are safe and healthy, in particular for our kids.
And with that, Mayor de Blasio and schools chancellor Misha Ross Porter ordered roughly 150,000 Department of Education employees, from teachers to principals to food service workers to custodians, to get vaccinated.
Currently, at least 63% of DOE employees are vaccinated. By September 27th, 100% will be well on their way to being fully vaccinated.
The mayor's office says it will negotiate the details with various impacted unions. The biggest, the United Federation of Teachers, says that is the expectation. But generally, public health experts like Dr. Sharif El-Nahal, president and CEO of University Hospital in Newark, say anything that encourages vaccination is a good thing in the face of COVID variants.
It's important to understand that vaccination does provide a benefit, as we know up to this point, for all known variants.
To that end, a recent study by the New York Department of Health shows vaccines still greatly prevent people from getting COVID and prevent hospitalizations, even in, quote, breakthrough cases. The study showed vaccines are 95% effective in preventing hospitalization. Even with the more potent Delta variant, the protection remains strong at 92%. The same study did show the two-shot Pfizer and Moderna vaccine regimen may fade over time. It's a large part of the reason why the FDA may very soon more widely authorize a third booster shot.
I think the data is still up in the air about whether a third dose would be particularly effective against Delta or really any other variant. But at this point, we know for sure that being vaccinated is a huge protection, especially against hospitalization and death.
Now, about the Lambda variant, you may have heard something about that, first identified in South America, and it may be somewhat vaccine resistant. We talked to health experts about that, wanted to find out what you should expect. Well, basically, the data we have on it's a little too early to know exactly what difference it will have against the vaccines, and it's not spreading quite a bit yet in the United States, so TBD how it affects us in this country.